Recently, we were looking at discussing low back pain, lumbar pain from the perspective of restriction and give. Obviously, there are pathologies that cause back pain, but it doesn't hurt to try and look at why those pathologies are creating the problem. And to do that, by looking at the structure and the reasons and the causes of the structure being problematic, can be quite useful, because it then allows us to treat accordingly. Obviously, as much as possible, we would like to follow an evidence-based sort of practice, but sometimes that's not always possible because simply the knowledge base is not there yet. And some of the evidence base is our own evidence base. As such, I have found a couple of techniques that I found to be quite useful when I'm treating from this perspective. Somebody may come in, they have bent forward, possibly pulled some of the capsular tissue around it, and then they have soft tissue guarding as a result of it. I'm not talking about discs here, I'm not talking about the problems with neural problems or sciatica. I'm talking about this sort of low back pain that sometimes presents as a result of a particular movement or a sustained movement, such as sitting in a chair all the time. There are quite a lot of things that we can look at. We can look at how the muscle tissue may be stretching or maybe a bit taut as the person bends forward and flexes, or there may be some sort of give at a crease, a hinging point as they extend. And these things may be addressed by looking at possibly how do I treat it with regards to a joint or soft tissue. So quite often I find, even if it's a joint, there is going to be some soft tissue involvement, whether it be trigger points or just tight muscles. And we can treat that by using sort of massage techniques, whether it just be gentle massage techniques along the various muscles of the spine. That could be quadratus lumborum. We could be treating some of the trigger points in quadratus lumborum, or just generally massaging it. And it was equally the same for the erector spinae along their length all the way up to the neck. We can also try and release off the hamstrings, because that can have an effect on the pelvic tilt and even the quadriceps. This is why massage can be quite effective in these cases. Some of the trigger point techniques we can use, the good old knobble. We can use the deep stroking massage around, for example, a quadratus lumborum trigger point, or the ischemic inhibition, whereby we press down and release and try and relax off the trigger points like that. Sometimes transverse movements with a nice sort of round sort of head can do the job. And obviously, if we don't have a knobble, then we can use our hands to do it. One thing I've recently come to start using is cupping. I've been doing some of the NAT courses on cupping, which I wholeheartedly recommend. And I find that this is quite a nice way of treating it. There's probably various reasons why it's working. It could be counter irritation. It could be we are doing some sort of lymphatic drainage, although I don't know how much that's relevant for our low back pain. We're moving the soft tissues for sure. In that itself, it could be sort of activating muscle spindles, various or a combination of the various things, including counter irritation, as I said. And I find that quite a nice little technique. I'll just put a little bit of oil on the back. I just smear it about. You may have done some sort of massage prior to that with the oil, and I've gone quite heavy-handed with the oil here. And I can massage in, and then sometimes I can then use the cups. Usually just one, possibly two little squeezes is enough. I then remove the head, and one can use cupping for trigger points, but there's also a very nice way of just moving it along the muscle tissue, and it lifts up some of the tissue, and I found that to be quite nice. There may be an element of placebo, and there is no problem with using placebo to help us treat. So I've released some of the soft tissue now, And then I may, having released the soft tissue, I will reassess how the patient is able to flex and extend, and see if there's any difference in that. And should I see that it's still a little bit tight, I may go back to treating with the cupping, or I may want to go in a little bit harder with regards to the trigger point techniques, either with my thumbs. I prefer the knob simply because I'm getting old and my thumbs tend to hurt after a while. So I can then use some of the ischemic inhibition, this pushing into the quadratus lumborum, and relax, and then some just gentle massage to finish it off. And then what I might often do is reassess again, and I will ask the client to sit up, and I will get them to bend forwards, and I will look to see if possibly there's any restrictions still, and if there is, I may use a Mulligan technique, or a normal apophyseal glide or a sustained apophyseal glide. There are various ways of doing it. You can actually put your hand around and support, and I just get the patient to push and bend forwards, and I help the vertebrae glide up and come back, and sometimes I'll sustain that as they come back. So as you bend forwards, I will hold this, and you come back up, and I'm holding. How do I know it's working? It's basically because the pain or the restriction in movement will go. They can also be done, if you remember, we had a hinging at this area, so we can get the patient to come back, and again I can help the vertebrae glide and then come back, glide and come back, and then I will get them to stand, and I will reassess them and check them again. We'll just show you again briefly, possible to do this with a belt. Attaching myself to the patient with the belt. I can then stabilise the pelvis, come in and bend them forwards, and they go back and come backwards and forwards like that. So if you have any effect, you'll know you're in the right direction, and that's one of the ways to kind of treat the restriction and give that we sometimes encounter with our low back pain patients.